money, and you know, we're getting at the bottom of the barrel. We still have some, but we're getting to the bottom. Amendment 2, only thing it does is it redefines the amendment without raising the debt limit. It allows us to refinance the bonds and really save money by doing that, and then reissue the bonds if we need them. But in order to compete against other states and to bring industry into Birmingham or any other part of the state, I have to have that.
You know, Airbus was a huge get for the state, expanding of Honda, expanding of Mercedes, expanding of Hyundai. Can you talk a little bit about, you know, just other major industries that the state would want to try to capture?
Well, one of the things that we have actually done as far as our strategic plan is something we call Accelerate Alabama, and that concentrates on 11 different industries in the state because we want to diversify and we want all of those industries to do well. And one of the industries that we did not have in the state was the assembly of aircraft, and of course not very many states do have that, but we were able to recruit Airbus, and they're going to Mobile, but all of those companies that we've recruited, all of those incentive money was part of that, and that's why it's so important that I be given the opportunity to have that available so that we can compete against other states.
Can you talk a little bit about, just with Airbus and these other industries, that it's not just that aspect. You actually get support industries that come into the state as well in order to help supply these industries.
Well, absolutely, and actually the amount of money that we put into a large industry like Airbus would not be worth it if it were just those number of jobs. Actually, what we get from that are the suppliers and the suppliers that will create companies all over the state. That really creates most of the jobs from a major industry like Airbus. And Mercedes was a very good example of that.
Governor, talk a little bit about this grant and this fund that's going to be able to help innovation and entrepreneurship, and how it'll also help small business owners be able to get some incentives.
Well, our innovation fund that we put into the Education Trust Fund year before last, actually for 2012, when we developed that budget. That money will be available to research institutions, to two-year college systems. This is mainly for education entities. And that money can be matched, though, with private money, can be matched with federal money, so that they can bring down more money. Innovation and entrepreneurship is a major part of job creation in this state. And it's also part of what we call Accelerate Alabama. Part of that, we not only recruit industries, we try to retain the industries that we have, but we also try to renew our industries with innovation and entrepreneurship.
Changing topics real quick, could you talk a little bit about opting for no essential health benefits under Obamacare for the state? I chose not to participate in that primarily because what we were offered did not include a high deductible insurance policy. High deductible insurance policies are key if we're to create health savings accounts in this state and in this country. Health savings accounts are the way we need to go because that puts the patient back in control of their first dollars. That's the way we need to fund health care in America.
And if you don't mind, just in keeping with health care, Cooper Green is a big issue in Jefferson County. Now they're going to close inpatient care as well as the emergency room department. As a physician, what are your thoughts in regards to what's going on in Jefferson County? Well,
it really boils down to a money issue, and it boils down to an issue of whether or not it's being run correctly. It's going to have to be downsized, but I want Jefferson County to still have an indigent hospital. I love Cooper Green, but there needs to be some changes. I mean, obviously, and organizational changes. It probably does not need to be as large as it is, and so everybody's got to give a little bit on this. Those who say, we're going to keep 500, I don't know how many people are working there. They're not going to be that many. You're going to have to give on that side. The county's going to have to give, but I believe it can be solved and still have inpatient for indigent patients and an outpatient system for indigent patients.
Governor,
And part of their plan is to partner with these other area hospitals, UAB, St. Vincent's, and so forth. And there's really no plan set in stone, so it would be taking the inpatient and taking it to these other hospitals.
It's a very complicated issue, and the reason it's very complicated is because many of these patients either don't have any insurance or they have Medicaid. And then you get involved with what's called CPEs and disproportionate share money and all the complicated things that are related to Medicaid. It is a very complicated issue. It can be worked out, though. And if all sides will come together, it can be resolved. I am very much still in favor of having an indigent hospital with inpatient care, but it cannot be what we have right now, and it cannot be the size that it is right now. One of the other reasons that I'm concerned about it, we have some osteopathic training programs at Cooper Green where we have residents that are family medicine residents that are being trained there. That brings down CMS dollars. It averages usually about $100,000 per resident, and I believe that we have 10 over there at the present time. So that's money that's coming into it. So there's more to it than just what people see superficially.
Governor, let's talk a little quick about sales tax collections in the state. Obviously, right now, one of the things that we're trying to do is capture as much money as we can in order to fund the budgets. However, there is the additional impact that online transactions are continuing to grow. We are losing a large part of that pie. How much is the state losing, and what is your office doing to try and find a way in order to capture that lost revenue?
Well, the federal government right now, in Congress, there is a free market fairness bill that they are contemplating voting on. And I have met twice with our delegation to encourage them to vote for that, because it really is a jobs issue. When online retailers can get a 10% advantage over local stores, that's not fair. And what happens is if local stores cannot sell, they cannot hire. And so it truly boils down to whether or not we are hiring people in this state and putting people back to work, because online sales companies are taking advantage of local stores. I want it to pass. It is a law already. You have to pay those taxes, but there is no way at the present time to collect those taxes and remit those to the local governments. Only through this federal fairness bill, this market fairness bill, will you be able to do that. So I'm very much for collecting the taxes that are owed. I'm not for raising taxes, but we do need to collect the taxes that are owed in this state.
Okay, all righty, thank you. Thanks, guys.